The Mogadishu-Afgooye corridor is home to thousands of internally displaced people who fled fighting between the Somali National Army or SNA and extremist Islamist group Al-Shabaab. Backed by troops serving with the African Union Mission in Somalia or AMISOM, the SNA forced the militants out of the capital and most urban centers in central and southern Somalia in 2011. Although the security situation in Mogadishu has greatly improved in the last 20 months, most of the people in the IDP camps have no access to basic services and only makeshift structures to shelter them from the elements. Burundi's AMISOM contingent has been here since 2007, when street battles, mortar fire and suicide bombings in Mogadishu were at their height. Medics working with the contingent have also been operating an outpatient clinic for the SNA and AMISOM at Somalia's former national university. The troops also offer free medical services here twice a week and whatever food they can spare to IDPs and other members of the community. Somalia's health sector, like most public institutions, deteriorated during years of war and lawlessness the country experienced after the toppling of Siad Barre's government in 1991. Medical personnel fled the country and health centers were either looted or left to ruin for over 2 decades. People like Mana Abdi Mohammed, who is visiting the AMISOM free clinic for the first time, have nowhere else to go until the new government is able to fill the gap.
My neighbors were coming here and encouraged me to bring my sick child. They told me that their medicines were good.
Dr. Malans Kazoya, the Burundian senior medical officer, and his staff are often overwhelmed by the numbers and diverse needs of the people who come in. Although it's an outpatient facility, they have between 25 to 30 beds for admitting some of the most serious cases, like this boy who has just been brought in. He appears to be severely malnourished and is still unable to walk on his own.
When we deployed, we realized that there were no health facilities and people had nowhere to go for treatment. Most of the cases we treat are infectious diseases, bacterial infections, lung disease, malaria, dehydration, and diarrhea due to lack of hygiene and clean water. We appeal to different partners to help us provide the various equipment and medication necessary for us to assist the population.
Last year alone, the Burundian medics treated close to 55,000 patients at the clinic, and although their medicines and other resources are routinely overstretched, they have continued to open their doors. Some Somali groups in the diaspora and local non-government organizations periodically donate medicine to the clinic, but the medics are calling for more help, given that the demand for the life-saving services they offer greatly outweighs their supplies. In the meantime, the troops are committed to helping their neighbors for as long as they can.